Hello, everyone, and welcome to the show. I have with me a wonderful cosmetic doctor, Dr. El-Attar. How are you?
I'm good, thank you. Thank you.
First of all, thank you for coming to Toronto. This is freezing cold to visit us. Not that it's warmer where you're from, New York, but thank you very, very much for agreeing to be on the show.
Thank you so much. It's my pleasure. My pleasure to be here.
So I'd like to start because you have, it's called Derma Laser Centers.
Yes.
Can you tell me a little bit what are those centers all about?
Actually, we started the Derma Laser Centers as a aesthetic medicine and surgery practice since 2002 in New Jersey. We have 3 locations there. And since the past 12 years, we've been doing both combination of preventative aesthetic services to prevent aging as well as treating the signs of aging using both non-invasive and invasive methods or minimally invasive methods.
It's a very, very interesting subject, aging. So I think I want to start with how to prevent aging.
Well, that's a great question. I think when I graduated in 1987, we didn't know much about why do we gracefully age and eventually die. But if we think about it with science, aging is definitely a preventable disease. It's the first killer of human beings. And in 2014 and beyond, we're going to learn more and more how do we stop the aging. Just to make it simple for our audience.
How to live longer, okay.
We do. We definitely will be able to live longer with all the advances in science and medicine. The reason why do we age and change in shape from a newborn face, like a baby where everybody want to hold him and kiss his cheeks and stuff, to a 90-year-old in a nursing home, is because we have 3 different mechanisms that contribute to our aging and eventual demise. The first is the mechanical aging. It means that we move our faces, we express ourselves, and we are exposed to gravitational forces 16 hours a day while we're sleeping only 7 to 8 hours a day.
Sure.
The second element is what most people don't know is the ultraviolet radiation in the sun. And when I was young, they always told me, go on the beach and be healthy.
Get vitamin D.
Yes,
very good for you, vitamin D.
Olive oil and relax on the beach. But
get more tan.
Yes, but right now we know that the sun has 3 different types of ultraviolet radiation. We have ultraviolet C, that's prevented by the ozone layer, except in Sydney, Australia. That's why we see 6 times more cancer of the skin in Sydney, Australia versus New York City or Toronto. Ultraviolet B, that's contribute for the tanning, so you can get a tan in summertime, but not in wintertime. Right. But the most dangerous, and most of us don't know about that, and it's a surprise, that's in a day when it's snowing in Toronto.
Oh, I know.
There's ultraviolet A that does cross the clouds. It's there as long as there is light in the sky, you are aging. Wow. And ultraviolet A destroys our skin, what we call photoaging. So we start having wrinkles, we start having sunspots, we start having broken blood vessels, what we call deterioration of your skin, or what we call it as doctors, photoaging. And that's how we do lasers to cure them, or we do chemical peeling. The third and most important part of aging, that as we grow more wiser, and I don't want to call it older, is
you're smart.
is what we call deflation.
Okay.
Imagine you bought a balloon on a birthday party, and this balloon is shining and nice. And you come visit that balloon, you forgot it in that room for 3 days, and you come at the balloon, and the balloon is all shriveled.
Yes.
So because our skin gets atrophied, our tissues or fat in the face gets atrophied, our bone gets absorbed with age. This deflation causes the face to shrivel and becomes much more thinner. And that's how that baby that we want to kiss becomes so aged. Right. So with these 3 different elements that we now know, we can actually use different things in our practices to reverse these 3 elements. Reverse the descent of the face with mechanical aging, reverses the deflation with fillers, for example, and reverse the photoaging with the effect of the ultraviolet radiation using lasers, IPL, or chemical peeling.
Wow. Wow. Okay, so but that's okay. So that's why there's changes in our skin.
Yes.
So give me some of the methods that you do to prevent it. To start with I guess with the younger generation.
Definitely.
Am I correct?
Yes, absolutely.
Because for me it's too late. But start with the younger generation.
It's never too late. But again, understanding the whole concept of what I said.
Right.
If we look at somebody in coma for 30 years, they look like angels because they're not moving these unnecessary muscles.
So you want to tell me if somebody's in coma for 30 years, they don't age?
Absolutely, they age much less quicker than somebody using the muscles of expression. Mm-hmm. So, for example, when we keep frowning and moving our facial muscle, we start developing what we call crow feet or forehead lines, right, or lines between your eyebrows. And guess what? You don't notice that on a daily basis when you're expressing yourself. Right. But when you look at your face and there are lines in your face, this is like footprint in the snow. Somebody walked in your backyard and put their footprints in the snow, what we call static wrinkles or static lines. So the best way to prevent these footprints in your snow in the backyard is to close that door so the guy would not step into your backyard. Mm-hmm. How do you do that? By medicine that relaxes your muscles. And funny enough, it was discovered by a Canadian doctor, our mentor, Dr. Jean Corrador in Vancouver, Canada. Wonderful ophthalmologist who...
A lot of good Canadians.
Yes, absolutely. Hooray for Dr. Corrador and her husband. So they got FDA approved in the United States since 2002 to relax the muscles that cause the frowning and all the negative expressions. So starting this injection earlier will stop these muscles from causing these footprints in the snow, so your snow backyard will always be smooth and nice.
So you want to tell me if you start with a younger girl, I don't know, what age would you consider starting Botox? At what age?
Actually, the FDA has approved this medication for moderate and severe lines between age of 18 to 65. But I have used it personally off-label on my own daughter since she was 15 because she has the worst muscles in the forehead. And Gina always had these expressions that, everybody thinks that she's upset. She's mad, but she isn't. So I used it before the age of 18. Mm-hmm. So I always say you are treating a human being. Every patient is a different individual. So depending on the patient, I don't think there is any complication or any long-term side effects of this medication being used for now, at least in my practice for 12 years, seeing, I would say, over 100,000 injections done and very acceptable side effects.
So I just want to understand. So Botox is a temporary one, right? How long does the injection last?
Yeah. Botox lasts usually in the beginning about 4 months.
In the beginning?
Yes. We have to be very careful about this duration because there's a lot of confusion. Some people think it lasts 6 months. Some people think it lasts 1 month. Always remember, we are treating patients. There's a big difference between treating a bouncer in a bar with big muscles and somebody with very, very thin muscles. So if your muscles are very powerful, Botox might last a little bit less. If your muscles are much more thinner and weaker, Botox can last a little bit longer, but the average duration is about 4 months.
Okay.
So in my practice, patients usually get it 3 times a year, and it's gas in your tank. So what happens is that after we inject it, it takes about 1 week to reach a full effect of the injection where you don't have any motion. And then as we go, when these 4 months, you still have 25% after 1 month. Half of the motion comes back in 2 months. And then eventually in 3 months, you still have a very little effect of the Botox remaining, where I usually recommend for patients to get it in 3.5 months after.
Okay, so I just want me and the viewer to understand. So when you do Botox, it lasts whatever, an average of 3 months, and you 4 months, 3-4 months, and you do it a couple times a year. My question is does that particular muscle that you inject, does it eventually freezes? Like
that's a wonderful question.
After all those injections?
That's a wonderful question. If we ever look at somebody, this medicine stops the muscle from motion. So what we have eventually is what we call disuse atrophy. But for that disuse atrophy to happen, we have to stop that muscle from moving for a period of at least 2 years.
Gotcha.
Look at somebody who had an accident and in a wheelchair and look at the muscles in the lower limbs, it's usually very thin and attenuated. Yeah. And that's exactly why Botox in some patients will last 7 months or 8 months, because the muscles have really have weakened significantly. Okay. So if we are doing the Botox on the dot, on the time, without any period of lapse between the injections, they get this effect. Remember, you move your muscles thousands and thousands of times in a day. Sure. So if you have, let's say, 1 or 2 or 3 days of period after Botox have already gone with the effect is completely finished, your muscle will train itself again and come back to base power. But if you're doing your Botox regularly after 3.5 months, your muscles within 2 years atrophy enough that you will have softer facial expressions.
And the reason I'm asking, and I'm just going to get off this subject, is because I see sometime, you even see on TV some, people yes. that do it, and then they're sort of, their muscles just are frozen. Their expression, you can see that they've done, some work on their face, but it doesn't matter. Let's go. What's just what's different between the Botox and fillers?
Like I said, back to basics about why do we age, we have 3 different mechanisms. Botox cures the mechanical or treats or prevent the mechanical element of aging, which is moving the muscles. While fillers is inflating your balloon again. Is inflating your deflated balloon to make it shiny again. You have a flat tire and you put air in the tire. So fillers fill the face. Whether that filler is made of a synthetic material or made of your natural fat, what we call fat grafting. So the difference between both is that fillers, again, most fillers in the market made of hyaluronic acid are temporary fillers. It means it's gas in your tank that will last 12 months.
Gotcha.
While fat grafting is your own cells, so it will live forever.
I've never heard of that, but that's a good one.
Yes, fat grafting is...
I've learned so many new things just sitting here with you. Okay, that's wonderful. Let's go to another, because before the show, you were telling me about, you do all kind of surgery, but you do also like breast reduction, and you were telling me about this amazing no scarring, and I was like, wow, you got to tell everybody with laser. Yes. This is amazing.
Yeah, breast macromastia or enlargement of the breast, it can be a very distressing problem for a lot of females. Sure. It's associated with back pain, with notching of the bra, with infection under the breast. Although men always, always look for women with large breasts, but women with larger breasts sometimes can be really miserable. Yeah. So the old traditional method of what we call reduction mammoplasty or reducing the size of this breast was through surgery, where we have an incision, like a T around the breast and around the nipple and areola, and associated with a significant number of complications like wound dehiscence, infection. Sometimes the areola and nipple have infection or necrosis because we move it from one area to the other. But the scarless breast reduction is simply a procedure that's based on a very simple logic. The breast is made of 2 components. Your breast tissue or your mammary glands, which is made of about 15 to 20 lobules or glands that connect through ducts into the tip of the nipple. And this is embedded in an abundance of fat in these people with a lot of a huge size of the breast. So what usually we do a mammogram prior to the procedure to determine how much fat versus gland in this particular patient. And simply with using what we call the Topal technique or the tumescent local anesthesia, power-assisted suctioning of that fat, we reduce the amount of the fat in this breast significantly. And not only that, but we can actually control, because 64% of women have a larger left breast than right breast. So sometimes we have a discrepancy of the size of both breasts, and we can actually adjust this discrepancy by suctioning more from the larger breast.
Wow.
And we follow this eventually by using a laser. And laser serves the purpose of heating the subcutaneous tissue and inducing what we call collagen formation. Collagen is a wonderful part of our body because it's like rubber bands. It's elastic. It recoils versus fibrin or the destroyed collagen in which you have sagging. It's like a rope. It doesn't retract.
Right.
So when we do the laser, we not only we have more evenness of the results, but the breast as well lifts to an extent. So not only you reduce the size of the breast without any incisions.
You get a breast lift as well.
Yes, but you get a mini breast lift. It's not exactly like a surgical breast lift, definitely, but there is some degree of lifting of the breast. The most important part about this procedure is that in comparison to a recovery time about 2 weeks where patients have to go through suture removal and all these kind of and drainage and drains and stuff like that, it's a procedure that patients will do and go to work the next day.
I'm amazed.
And it's totally under local anesthesia.
It's like dissolving the fat?
It's suctioning the fat.
Suctioning the fat.
Suctioning the fat through a very small port that in the axillary tail here and right underneath the breast in 2 sides. So there's a little, about 2 millimeter port that from which the device will suck out the fat, leaving the glands untouched. So women can still breastfeed, can still do all the activities of the rest without any
I'm
effects.
sorry, guys. I didn't know this guy was so wonderful. I would have brought picture before or after. We're gonna tell him to come back
Next
again.
time we will definitely.
This is amazing. Now, one more thing that we got to get from this wonderful guy. You were telling me about also liposuction, laser liposuction.
Yes.
This is like amazing.
Yes.
Maybe it's amazing. I mean, I haven't heard of it. I haven't
actually, liposuction just for the.
Well, liposuction, I know, I've heard.
Yeah, for the public,
And, and I just got to tell you, sorry, I've actually seen a friend that did liposuction because she stayed in my house and I had to look after her for a week. It was horrifying.
Okay.
Just horrifying.
What year was that?
Maybe, I don't know, seven years ago.
Okay.
It was horrifying. I mean, she was black and blue all over and just horrible. Okay. So, I mean, tell me if there's something different.
I'll just make it very quick and very short.
Yes.
Liposuction is one of the most common cosmetic surgery, plastic surgery procedure on the planet Earth. The reason why, because over planet Earth in general, we have 50% obesity plus. The most important thing about liposuction, we all have to understand that liposuction is no different from our cell phones, from our computers. Okay. It's a procedure that evolved from a very primitive way of doing when Dr. Arbad and his son, Gregory Fisher and Arbad, his son, who are gynecologists in Rome, started the procedure in 1973 until today in 2014. Sure. It evolved significantly. The state of the art of liposuction is a procedure that's done completely under local anesthesia with no sedation. It's done with the tumescent technique, i.e. we use local anesthesia like the dentists use Novocaine in your teeth. And this particular procedure done under this technique, number one, prevent any infection. There is no infections reported with this technique whatsoever since it was performed. Second, it's prevented the fatal complication of fat embolization where the fat cells can go through the blood vessels and cause fatal embolization in your lungs because it closes the blood vessels. Number three, it makes the bruising after the procedure almost non-existent. Wow. And because there is no bruising, like your friend had, there is no pain post-operative. Yeah. So patients are able to go function, drive themselves back home, same day of the surgery, and go to work the day after. The second element is that instead of using the old traditional big cannulas that was scary, we now use micro cannulas that operated automatically with power drills that makes the procedure very, very easy and less traumatic than before. Above all, the most big drastic effect of liposuction was about the irregularity of the skin. So when you look at the skin of the patient after that, it's very hard for the surgeon, no matter how good he was, to have this even appearance of the skin, and sometimes that can be a little bit distracting to the patients, and people can be pointing out on the beach who had liposuction and who did not. The addition of laser at the end is like a torch of fire on top of an ice cream bucket. What we do with the laser, we smooth it out. We put the fire on top of the ice cream and we freeze it back, so the surface is completely smooth.
Amazing.
And the skin as well contracts because laser induce collagen remodeling. Right. So now the sagginess after the procedure, the deflation of the skin after you remove all that fat is not an issue anymore.
And it doesn't matter how, like, I don't want to say fat, like
how much do we take?
Exactly, like, if it's, I mean, some people had a little bit, some people, how much does the skin go back? Because I've seen some shows where, they took, I mean, the skin, there's so much of it. How much can it go back? Or is it a certain amount that it just doesn't go back?
Yes, laser usually, the use of laser usually adds about 16 to 20% skin contraction. Even if you have to excise skin, if somebody have a procedure prior that caused a massive weight loss, like a gastric bypass or a sleeve or one of these procedures, when we have to do body lifts, this 20% contraction of the extra skin will make the body lift or the extra skin excision 20% less. 20% less scarring, 20% less length of the incision. That's why we have now something called the mini tummy tuck versus traditional tummy tuck. The mini tummy tuck, or a procedure called the Avalar, is done under local anesthesia when we just excise that extra pad of the skin that's present. But as we progress in science and technology and devices, I'm pretty sure that in the next decade or so we'll see a whole lot of advances that make everybody happy.
I'm telling you, I thought we will have a lot more time to talk about so many other things. The last question that I'll be, like, who has more surgery, men or women?
Definitely, until now, women have.
But are the men catching up quickly?
In the last 10 years, we have 40. That American Society of Aesthetic Plastic Surgery increased about 45% of the procedures performed in men. Last year, we have about 280,000, 260,000 Botox injections, while 6 million women had it.
Amazing. And just like, what are one of the most popular procedure for men and for women?
The most popular procedure last year for women was probably breast augmentation. Liposuction came as third, 200,000 procedures in the United States. For men was rhinoplasty. And for non-invasive was Botox for men, followed by laser hair removal.
Amazing. You're so wonderful and so knowledgeable and so great.
Thank you.
I wish you come back. I know you don't live in Toronto.
I love Toronto, especially in wintertime.
It's wintertime. Please, anytime you're here, come and talk to us. I mean, I think we'll learn so much. And in the next few weeks, we'll have some of the people from the clinic here in Toronto to continue his work. Thank you very much. Thank you for coming.
It was my pleasure.
And thank you very much, and I'll see you next week.